Total knee and hip replacements are quite common these days. According to the Agency for Healthcare Research and Quality, doctors perform nearly 300,000 total hip replacements and 600,000 knee replacements each year. What you may not realize is that orthopedic surgeons can now successfully replace ankles, too.
Most of us probably know or have neighbors or relatives who've had a knee or a hip replacement. And typically those joints essentially wear out over time, so kind of wear and tear or the aging process in the joint. The unusual thing about the ankle is actually the vast majority of ankle arthritis is caused by trauma, so previous injuries or ankle fractures, for example. And so sometimes the patients that require a ankle replacement tend to be a little bit younger and to some degree generally were more active and more functional.
That's Dr. Simon Lee, a specialist in foot and ankle surgery at Rush University Medical Center and Midwest Orthopedics in Chicago.
We would really say we're between our second and third generation of ankle replacements. So this is not a new idea in foot and ankle. It was actually used and created even back into the 60s and 70s. But what we found back then was that a lot of the joint replacements, a lot of the ideas and theories and kind of the implants that we used failed and kind of failed miserably. So to some degree, we kind of scrapped that whole idea for a while and really within the last 10 to 15 years have ankle replacements made a comeback. And the reason I think that they're so successful nowadays is really we are kind of building upon the information, the knowledge, the technology that hips and knees have and kind of using that to kind of supplement what we're doing in the ankle now.
Lee says that many people who need an ankle replacement are in severe pain due to arthritis, often the result of an injury. 30 or 40 years ago, surgeons could provide pain relief, but with a major downside.
Some people would consider the gold standard of ankle arthritis treatment or surgery was unfortunately fusion, fusing the joint closed or welding that actual joint. The problem with that is most of us can kind of go back and think about any joint that we have in the body somewhere that moves and has a normal movement as part of its function, and imagine that if we froze it or kind of fused it, it just doesn't make a lot of sense. And ultimately for the ankle, we know that fusing the ankle causes a lot of subsequent undue stress and stresses on other areas of the body, for example, the other leg, the knee, the hips, the low back. And so as a result, arthritis actually kind of accelerates or builds up in other areas as a result of an ankle fusion.
Fortunately, today's ankle replacement provides both pain relief and ankle flexibility.
There's 3 bones that are surrounding the, quote, ankle joint. So there's the bone in the foot that we call the talus, and then really the 2 leg bones, essentially I think some people would characterize it as the shin. Those are 2 bones that kind of help trap that talus bone in between them. We actually come through the front of the ankle and cut out part of the actual ankle joint and replace that with metal on either side of the joint that kind of helps support the prosthetic. And then typically there's a high-tech plastic that kind of resists pressure and also friction that almost acts like the joint so that it allows the motion to be maintained.
I'm the head of the Yorkville Judo Club, and I have some other instructors that work underneath me. So I was down there more in a supervisory capacity because it really hurt to walk on my ankle. And then I had a clicking noise where it would be impossible to sneak up on somebody because they could hear you coming. And it just got to the point where it was so painful to walk on it, I decided I had to do something about it.
That's 81-year-old Robert Corwin, who was once again an active judo instructor in Yorkville, Illinois. But before his ankle replacement, he was on the sideline.
To be able to move the ankle normally is very important in judo because of the nature of the sport, where a lot of times all your body weight plus your opponent's weight is on one leg, on one ankle. You have to be able to lean forward on the ball of your foot in the throw, in a forward throwing technique. Ankle replacement was the best option because I had multiple hip replacements, I had knee replacement, and they all worked out great.
Lee says patients begin to move the ankle around during physical therapy in the first 6 to 8 weeks, but can't bear weight on that ankle yet.
Then most patients are kind of in this graduated return back to weight-bearing and functional activity for the next 6 to 8 weeks. So really, most patients are about 3 or 4 months out from the actual ankle replacement. before they're trying to put regular shoes on and kind of getting back into their normal routine and activity. But most patients are probably 9 months to a year before they can say that they're back to everything that they want to do. That being said, while the ankle replacement is good, it's not great. Most of us would probably recommend and counsel our patients to avoid any repetitive or high-impact type activities. So running or jogging is not something we would recommend after an ankle replacement. Certainly other activities like riding a bike, golfing, walking for exercise, some judicious elliptical use, for example, is okay. Swimming is okay.
And apparently, judo is okay, too.
Because of my age, I just teach technique and demonstrate it. But I also teach sports performance classes where we're doing a lot of running technique, quick foot ladder, jumping and all that, and I can demonstrate that, where before I had the replacement, it was to the point where I couldn't demonstrate anything.
Experts say total knee and hip replacements can last up to a good 20 years or more. Ankle replacements don't have quite as good a track record, at least not yet.
When I started this practice in foot and ankle, I couldn't actually tell patients how they would do in 10 years because we actually didn't have that data and we didn't really know. Ultimately, I think ankles, we're not quite there in terms of knees and hips. Most of us would hope that most of these implants would last 12 to 15 years for the majority of the implants. So really we're looking at 85% of these implants lasting 12 to 15 years at least. And ideally, as we continue to study these implants and kind of follow the trends, we can kind of figure out why some of these will fail earlier and then incorporate that into future upgrades or technology of ankle replacements to kind of extend that even more.
For the time being, you may still need to travel to find a medical center that specializes in ankle replacement, but Lee says you can be assured that a painful ankle joint can be replaced these days with good results. You can learn more about ankle replacement through our website at radiohealthjournal.net. Our writer this week is Polly Hansen. Our production director is Sean Waldron. I'm Nancy Benson.
Medicare and their list of suppliers continue to change, so if you have diabetes, it may affect where you get your testing supplies. But rest assured that your number one doctor-recommended one-touch testing supplies are always covered by Medicare Part B at your local pharmacy and approved mail-order suppliers. Dr. Brian Levy, Chief Medical Officer at LifeScan, maker of one-touch products.
Some mail-order suppliers may offer a limited selection of diabetes testing supplies. They may try to switch you to a different brand, saying your current products are no longer covered. That's just not true. You are entitled to continue using the products you know and trust and that have been recommended by your healthcare professional at no additional cost.
Remember, you have a choice. Stay with the number one brand used by Medicare patients. For questions about coverage or where to get your one-touch testing supplies, call 1-866-621-6216 or visit www.onetouch.com/Medicare. Medicare Part B is not a guarantee of coverage and payment, which may be subject to coinsurance, deductible, and patient eligibility requirements.
Is your daily routine putting you at risk for catching the cold or flu? Each year, there are 1 billion cases of the common cold or flu in the U.S., which typically begins when virus droplets are inhaled from a sneeze or cough or transmitted by touch. Placing yourself within close proximity to infected people or surfaces may put you at a higher risk. Curad Chief Nursing Officer and Advisor to the American Nurses Foundation, Marty Moore, has a few suggestions for staying protected.
We all know it's impossible to never leave your home or wear an outbreak contamination suit to ward off germs. But you can assess your risks and take simple steps to help protect yourself, such as using hand sanitizer, wearing a Curad antiviral face mask when out in public, and avoiding excessive workouts.
Whether you're a working mom, stay-at-home dad, or college student, Marty advises all people to take a cold and flu assessment quiz and receive a personalized protection plan at Curad.com.
Health and fitness goals are often at the top of everyone's resolutions list. Older Americans share in those too, and Silver Sneakers Fitness can help. Silver Sneakers is the nation's leading fitness program designed for older Americans. They can help you set goals and find motivation, whether it's playing with grandchildren, completing a race, or traveling for a dream vacation. Sims Corbett is Senior Learning Designer for Silver Sneakers.
One of the biggest predictors of success is planning to make fitness and health changes in a manageable and reasonable way, setting small goals and doing what you love. One of the easiest ways to get started is with our Silver Sneakers classes that are offered in neighborhood settings, from adult living communities and senior centers to to park, churches, and more. Members can enjoy classes such as walking, hiking, yoga, and Tai Chi, just to name a few.
Silver Sneakers has changed thousands of lives, and more than 12 million people are eligible for the Silver Sneakers fitness benefit through leading Medicare Advantage health plans, Medicare supplement carriers, and group retiree plans. Find out more at silversneakers.com. That's silversneakers.com.